It's called vaccine chaos. Some vulnerable seniors cannot get COVID shots amid spiking cases in COVID. Tyrone Bowman live. According to the Los Angeles Times, seniors in some parts of the country say they are being denied COVID 19 vaccinations. Amid an ongoing spike in cases, the Food and Drug Administration has only approved COVID 19 vaccines for those aged 65 and up, as well as younger people with underlying health conditions. Seniors in some parts of the country say they are being denied COVID 19 vaccinations amid an ongoing spike in cases, leading to rising frustration over new Trump administration policies that are making it harder to get the shots. Matthew D. Amico, who was 67 of New York City, said a Walgreens declined to administer COVID 19 vaccines to him and his 75-year-old wife on Friday because they didn't have a prescription. They're trying to get vaccinated ahead of a trip. Quote, I can't believe we can't get the vaccine, D. Amico said in an interview. I've been inoculated a number of times and never had to get a prescription, and it's very frustrating that this is where we are. He's not alone in his exasperation. Under the leadership of vaccine skeptic, Health and Human Services Secretary Robert F. Kennedy Jr., federal agencies have effectively made it more difficult to get vaccinated against COVID 19 this year. The Food and Drug Administration has only approved COVID 19 vaccines for those who are 65 years old and up, as well as younger people with underlying health conditions. That means across the country, people younger than 65 interested in getting the COVID 19 vaccine must now either consult with a healthcare provider or attest to a pharmacy that they have an underlying health condition. It's a potential hurdle that can make getting the vaccine more difficult, and some health experts worry prompt even more Americans to eschew getting vaccinated. As D. Amico can attest, though being part of a group for whom the COVID vaccine is approved doesn't necessarily guarantee early access. For me to go to my primary healthcare provider now and get a prescription, it's just kind of ridiculous, D. Amico said. At least some people younger than 65 are encountering pharmacy staff asking probing questions about their medical conditions. That happened Friday at a CVS in Orange County, according to 34-year-old Alex Benson, who takes medication that can suppress his immune system. Besides just protecting himself, he wanted to get vaccinated as he has family members who are at risk should they get COVID. His mother is immunocompromised, and his mother-in-law had open heart surgery on Thursday night. Benson said an employee asked why he thought he was eligible for the vaccine. They asked me for either a prescription or they wanted to know why I felt I needed the vaccination. Benson said, at one point, a staffer offered to call his doctor to get an authorization for the vaccine. Benson said he was alarmed by the questions and started to feel kind of some desperation to plead my case to the pharmacist. Another CVS staffer later came over and said further answers weren't necessary and simply attesting he was eligible was good enough. He eventually got the vaccine. Still, he felt the experience was dismaying. I think easy access should be the policy, Benson said. I tend not to get too political, but it seems just rather juxtaposed to me that an anti-regulation administration is using regulation in this way. They're supposed to be removing barriers to health care. The vaccine chaos comes as COVID-19 is either increasing or starting to hit its late summer peak. According to data released Friday, there are now 14 states with very high levels of coronavirus detected in their wastewater. California, Texas, Florida, North Carolina, India, South Carolina, Alabama, Louisiana, Connecticut, Utah, Nevada, Idaho, Hawaii, and Alaska, as well as the District of Columbia. Dr. Elizabeth Hudson, the regional physician chief of infectious diseases for Kaiser Permanente Southern California, said data continue to show an increase in coronavirus cases. Over this past week, we've seen an increase in the number of outpatient cases and even a smattering of inpatient cases, Hudson said. It appears that we may be nearing the top of the wave, but it may be another 2 weeks or so until we truly know if we're there. The rate at which coronavirus lab tests are confirming infection also continues to rise statewide, and in the Los Angeles area, for the weekend ending August 30, California's COVID test positivity rate was 12.83%, up from 7.05% for the week ending August 2nd. In LA County, the positive test rate was 14.83%, up from 9.33%. Other data, however, suggests some areas may have reached their summer COVID peak. In Orange County, the COVID positive test rate was 13.1%. That's below the prior week's rate of 18%, but still higher than the rate of the week that ended August 2nd, which was 10.8%. In San Francisco, the test positivity rate has been hovering around 9%. For the last week of reliable data available, it's up from 7% a month earlier. In addition, wastewater data in Los Angeles County show coronavirus levels declined slightly from the prior week. It's too early to know if this decrease in wastewater viral concentrations is the first sign that COVID-19 is actively peaking or is regular variation typical of this data source, the LA County Department of Political Health said. COVID hospital admissions in California are increasing, with the latest rate of 3.93 admissions per 100,000 residents, up from 2.38. But they remain relatively low statewide and in LA County. The number of LA County residents seeking care for COVID-related illnesses or who have been hospitalized is quite a bit lower than during summer surges in 2023 and 2024, the Public Health Department said. A relatively mild summer wave, however, could mean that the annual fall and winter COVID wave might be stronger. In July, the State Department of Public Health said that scientists anticipate California would see either a strong summer COVID wave or a more significant winter wave. The current confusion over federal COVID vaccine policy has been exacerbated by the chaos at the U.S. Centers for Disease Control and Prevention, where Kennedy earlier this year fired everyone on the influential Advisory Committee on Immunization Practices and orchestrated the firing of CDC Director Susan Martinez just 29 days after she was confirmed to the post by the Senate. Now that's some real crap, because she probably didn't want to go along with his assessments. Some of Kennedy's hand-picked replacements on the ACIP have criticized vaccines and spread misinformation, according to the Associated Press. Of course, they're told to lie. They're told to outright lie. That's why they're there. They're not there to help people. They're not there to help people stay healthy. You know, if you are an anti-vaccine advocate, why all of a sudden would you want people to be vaccinated when that is your whole MO? Whether folk agree with my comment or not, that's the plain truth. You can't trust these people because all they do is lie. They have their lying points. They're not even talking points. They're lying points that they carry with them wherever they go. And when the cameras are on, they just pull out their lying points and continue to lie. Jim O'Neill, a Kennedy deputy, is a critic of health regulation and has no training in medicine or health care, the AP reported. See what I mean? The CDC hasn't issued its own recommendations on who should get vaccinated, and that inaction has resulted in residents of a number of states needing to get prescriptions from a health care provider for at least the next couple of weeks. You know what's going to happen? God forbid. If a lot of people get sick and they die, then they're going to blame it on Biden, and he's not even the president. They're not going to blame it on the inept Secretary of Health. They want to put the blame on Biden and Harris, instead of accepting responsibility for what they are now doing in this nation. It's always the scapegoating effects with these people. Find the scapegoat, spread it all around, just say the same thing, don't change, attack, attack, attack. That's the whole MO. Just attack, just attack, just attack, lie, lie, attack, attack. And then when Democrats do it, then they have a problem. Then when Democrats start lying and start attacking them, then they can't take it. Just like they can't handle the fact that Governor Newsom in California is redrawing the maps, the congressional maps. What are they trying to do? Take him to court and sue him from stopping. Come on, get real. As of Friday, CVS said people need a prescription to get a COVID-19 vaccine, sometimes depending on their age. In Arizona, Florida, Georgia, Louisiana, Maine, North Carolina, New Mexico, New York, Pennsylvania, Utah, Virginia, and West Virginia, as well as the District of Columbia. I wouldn't beg these people for nothing. Do not belittle yourselves and grovel at the feet of these people and beg for anything. CVS couldn't even offer the COVID-19 at its pharmacies in Nevada. As of Friday, they were only available at the company's Minute Clinic sites, according to spokesperson Amy Thibault. CVS said it expects to offer COVID-19 vaccines without prescriptions at its pharmacies in New Mexico, Nevada, New York, and Pennsylvania, due to recent regulatory changes in each state. Now, which one is it? Either they're not going to offer it in all these states that I just read, or they're going to offer it. This is confusing. I just read the list where they said they couldn't be offered. What were the lists? Arizona, Florida, Georgia, Louisiana, Maine, North Carolina, New Mexico, New York, Pennsylvania, Utah, Virginia, West Virginia, and the District of Columbia. Now they're saying that in New Mexico, Nevada, New York, and Pennsylvania, pretty soon you'll be able to just go and get a COVID shot. Right now, all patients in all states need to attest to being eligible for the vaccine in order to schedule an appointment online. Thibault said if an adult says they have no underlying health conditions but do have a prescription from a health care provider for off-label use of the vaccine, they can't get the shot. Thibault confirmed. On Thursday, Hawaii joined California, Washington, and Oregon in launching the West Coast Health Alliance, an interstate compact meant to provide science-based immunization guidance as an alternative to the CDC. Together, these states will provide evidence-based immunization guidance rooted in safety, efficacy, and transparency, ensuring residents receive credible information free from political interference, according to a statement from Governor Gavin Newsom's office. You know, Hitler was a great propagandist. Stalin was a great propagandist. He would just spread the stuff in the streets, make up all kind of leaflets, have the airplanes just go around flying all around and just drop the leaflets in the street. Gullible people. And would believe whatever came out of Hitler's mouth. The statement suggested that the Trump administration was essentially dismantling the CDC. The absence of consistent science-based federal leadership poses a direct threat to our nation's health security, the statement said. To protect the health of our communities, the West Coast Health Alliance will continue to ensure that our public health strategies are based on best available science. It was not immediately clear, however, whether the information of the West Coast Health Alliance would make it easier for people to get COVID-19 vaccines at the nation's largest pharmacy retailers, where many people get their shots. Mainstream medical groups, such as the American Academy of Pediatrics and the American College of Obstetricians and Gynecologists, are also offering their own recommendations to advise individuals and families on what vaccines they should get. And in closing, I'll tell you, do your own research. Don't sit back and wait for somebody to tell you what's best for you. You know your own mind, you know your own body, you know your own immune system. Do what's best for you. Let's go to the comment section real quick. Fred says, it's amazing how they can detect this from wastewater. Drake says, okay, whatever. First of all, Drake, you don't know what the hell you're talking about. I'll just tell you very plainly. You don't know what the hell you're talking about when it comes to me. You don't know what's in my mind, and you don't know what's in my heart. So I'll just look in the camera and say it one more time. When it comes to me, you don't know what the hell you're talking about. And I'll leave it right there. I'm not going to bow down like you do as a MAGA Naziite and go along with any and everything. I will oppose anybody that's doing wrong. I don't care what party affiliation they belong to. Doesn't matter. I don't care if they're Democrat, Republican, Independent, Socialist. If you're not doing what's right, you should be criticized. And that's the bottom line. Christopher said, What the hell are you talking about? I'm responding to a comment that Drake said. And I'll say it again. When it comes to me, you don't know what the hell you're talking about because you don't know me. You know nothing about me. Just like I don't know you. And if you don't like it over here, then don't come. Go to somebody else's live. Go to another channel. But I'm going to find the best articles and the best information available and make it available to those who want to hear it. Never surrender. Never quit.